Now, in an era where global health challenges are more interconnected than ever, India stands at the forefront of developing local solutions with global impact. From groundbreaking research to policy innovations, we'll explore how the principle of Vasudhaiva Kutumbakam, the world is one family, is guiding India's approach to health and well-being. Joining us for this hour, an extraordinary panel of experts and leaders. So to begin with, we have with us Indu Bhushan, founding ex-CEO of Ayushmann Bharat, Senior Associate, Johns Hopkins University. We also have with us Banega, Regional Marketing Director, Health South Asia Reckitt. And together, we're going to be talking about the latest developments. Mr. Bhushan, can you hear me? Am I audible?
Yes, I can hear you. Thank you very much for inviting me.
Thank you so much for joining us. Drawing from all your experience with Ayushmann Bharat, how can India's approach to healthcare, particularly local solutions, be scaled up to address global health challenges?
Absolutely, Ayushmann Bharat itself is an example that can be scaled up and can provide a lot of lessons to countries all over the world, including Global South, Right now, as a founding CEO, I feel so happy that every day more than 50,000 treatments are being provided free of charge to people who are like rickshaw pullers, daily wage workers, farmers, and others. And they're saving millions of people every year from destitution and financial crisis. And what can India show to others? One, in making this program, we have this IT system. It's like a global digital public infrastructure. This IT platform is end-to-end solution, which identifies the beneficiaries, ensures that beneficiary is the genuine one, and starts with the admission of the person to diagnosis, to treatment, to discharge, and after that the same IT platform is used for payment to the hospital by either insurance company or by the government. So this IT platform with that backbone that we've created has replicability all over the world. Recently, Ministry of Health from Egypt was in touch with me how we can replicate that there. Not only IT platform, we have other things like how to involve private sector, because about 80% of the tertiary care is being provided by the private sector. And Ayushmann Bharat has been able to involve private sector in providing these services to the poor people and ensuring that the quality is good and private sector is paid on time is also something that we can show to the whole world. Quality assurance mechanism, grievance redressal, fraud analytics, and there are many more things that we can share with others. As you also might know that we have added people over 70, all people over 70, irrespective of where they come from, with Ayushmann Bharat. Again, this is something that we can teach. I just want to, I know I've been talking for long, just two things. One, the linkage with primary healthcare. India also has a huge network of health and wellness centers. Now they're called Ayushmann Bharat Arogya Mandirs, and we have close to about 150,000, 160,000 of them. And linking them with Ayushmann Bharat, PMJ, so that they can screen people, and if they need some support, they can be referred for treatment, and when they are treated and discharged, and these Arogya Mandirs can provide the follow-up services. As earlier was discussed, that now burden of disease is shifting towards non-communicable diseases, and these are the diseases that will require long-term support. And India can show that model, that how linkage of primary healthcare and tertiary healthcare can provide these long-term solutions. And lastly, we have launched this National Digital Health Mission. Now it's called Ayushmann Bharat Digital Mission, which actually will be a game changer, which will improve the access to healthcare. It will make it more accountable, and it will be more responsible, and we can ensure the quality of healthcare. And this is another thing that India can give to the world.